So good morning, my name is Sarah Newberry and I'm Chief of Staff here at Wilson Memorial Hospital and the two site hospitals of North of Superior Healthcare Group. This is our weekly touch base with the community, and as part of this video, you'll hear messages from several of the staff of our two hospitals. But there are a couple of things I wanted to talk about and reinforce today. At some point today, we'll be hearing the projections for the whole of Ontario. Our Premier will be making that data available. But I do think that it's important for us to understand what's evolving in a local context. So I'm going to take you back to some of the data that we've looked at before. This is Marathon specific, but broadly can apply to Terrace-based Scriber as well. So in the communities of Marathon, Big Tigong, and Netsagamik First Nations, we know that we have roughly 4,500 charts at the clinic reflecting our population. As we've talked about before, we know that roughly 5% of people who contract COVID-19 will require hospitalization. And we've been looking at data that's emerging from the United States because the United States is a population that's probably most similar to ours. And what we're coming to understand is the who of hospitalized patients. So who is most likely to be hospitalized? Well, we know that those over 65 are much more likely to be hospitalized than those under the age of 65. We know too that people who have chronic conditions are also much more likely to be hospitalized. In fact, in the United States, with the data that's available, and it is not perfect data, but it's the best that we have right now, we know that 70% of people who required hospitalization had one or more chronic conditions. Only 30% of those who were hospitalized were healthy individuals with no underlying chronic conditions. What does that mean for our population? So if we think about our population over the age of 65, we have 800 people who are over the age of 65 in our total population here. Of the chronic conditions that emerge as important from the COVID-19 pandemic in the US, diabetes, chronic heart disease, and chronic lung conditions are really the big three. And here in Marathon, we have over 500 people with diabetes. We have more than 150 people with COPD, which is just one chronic lung condition. And we have over 600 people with hypertension, and if we use that as a bit of an indicator of who might have cardiovascular disease or heart disease in our population, we can see that there are many, many people in our population who are at risk of requiring hospitalization. As we've talked about before, we have 10 acute care beds in our hospital, and we need to be able to manage an influx of patients with COVID-19. How are we going to do that? This is where we come to the issues that we've been talking about for a long time now. Self-isolate if you've traveled to a high-risk area or if you have symptoms. Self-isolating for 14 days is really, really important. You can also, in our local community, have an appointment with the assessment center if you have symptoms to be swabbed for COVID-19. It's really important that if you need to leave your home, that you're practicing physical distancing. So being 6 feet from other people around you. And that practice of physical distancing is really critical to try and prevent the spread of COVID-19. That includes also coughing and sneezing into your elbow and really frequent hand washing. We also know that we really need to protect the vulnerable, and in our communities, that includes everyone who lives in chronic care, everyone who's in supportive housing at the Manor, and all of our independent seniors over the age of 65 and all those who are living at home with chronic conditions. If we can protect those people well, we will be able to prevent the surge of hospitalizations that we anticipate we could have if we are not successful with self-isolation, physical and social distancing, and protecting our vulnerable. I also want to add one more thing. Because as we think about those people who are going to require care in our assessment center and in our hospital, we need to think about the precious resource that we have in our healthcare providers. And that's everyone from physicians to nurses to housekeeping staff to all of the people who work in our healthcare settings. We know today that roughly 10% of people who have COVID in Ontario our healthcare workers. And this is a precious resource that we need to protect. Two things about that. When you come to the clinic, assessment center, or you come to the hospital, it is critical that you let us know your symptoms. Cough, sore throat, runny nose, fever, all of those things. There will be several symptoms you'll be asked about, and you need to let us know if you have those symptoms. If you are asked to wear a mask, it is critically important that you put the mask on properly and that you wear it properly for the entire time that you are in the healthcare setting. These two things are going to help us stay healthy so that we can continue to help you and our communities. I know these messages aren't easy. I know that what we're asking of people is hard, but we want to do our best for you every day. We are in this together. Thanks.
My name is Bonnie. I'm a registered nurse at the McCausland Hospital here in Terrace Bay. Just asking you all to please stay home to protect my vulnerable chemotherapy patients.
Hi everybody! This is Lisa and Carly from the August 7 Medical Clinic, and we're just asking everyone in the community to do your part by continuing to social distance and adhere by all the advisements from public health to keep our community and keep you safe.
My name is Megan. I'm an X-ray ultrasound tech at McCausland Hospital. We're asking you to stay home and stay safe so you're not our next patient in the X-ray room.
Hi, I'm Amanda, and I will be the first person you see if you visit the hospital. I am doing this screening for the COVID-19, and I would just like to remind you that it is absolutely necessary to stay home and only go out if you absolutely have to.
My name is Michelle. I'm one of the physiotherapists in the physiotherapy department here at McCausland. The face in the middle of the COVID virus experience, the face of physiotherapy has changed a great deal. We've gone to just one patient at a time in our department and only emergency patients. We've also moved on to video conferencing and telephone appointments for many other patients. We've done our part to protect the community, the public, all our friends and family. Now it's your turn. We'd ask you to stay home, let us get through this so we can get all our services back to normal. And remember, don't think of it as staying home or being stuck at home. Think of it as being safe at home. Thanks so much, and we'll see you all back in our hospital soon. Bye.
It's important for you to stay home and protect us healthcare workers that are still working.
Please stay home to protect your family and mine.
Please self-isolate, keep your distance. For my grandma, please.
Hi, this is just an importance about hand hygiene and self-distancing. Hand hygiene, soap and water, to remember to wash your hands for 20 seconds, rinse for 20 seconds, and dry your hands thoroughly if Purell is not provided. And if you can keep yourself healthy, then we can, as healthcare workers, can come to work healthy to provide the services we need to provide to you to have a healthy community.
Good day. As a chief nursing officer and as a daughter who has a father that lives at Peninsula Manor who's 93 years old, I am really asking that the public pay attention to the messages that you're being given. Wash your hands. Practice good hygiene, practice good social distancing, practice self-isolation when you've been told to self-isolate. Let's work together to keep our community safe. Thank you.
Hi, I'm Amy, and I'm part of the Environment Services team here at McCausland Hospital. We're working very hard to do our part in the fight against COVID-19, and we ask that you do your part by staying home and only going out when necessary.